we all know that a new baby brings immeasurable joy, but it also comes with a long checklist of responsibilities for new parents, especially when it comes to those crucial early vaccinations. But what if a little nudge could make a world of difference? Today, we're looking at an inspiring program in northern Nigeria called All Babies Are Equal. Now, since 2017, it's been providing small cash incentives to families who get their infants vaccinated on schedule. It's a simple idea with a profound impact. Now, parenting with local clinics to ensure every baby has a fighting chance at a healthy life. It's a powerful story of how a small gesture can protect an entire generation. Now, to help us navigate this, we're joined this morning by the man who helps oversee this massive and life-saving operation, Mubarak Bawa, the operations coordinator for new incentives, All Babies Are Equal. Thank you for joining us.
Thank you for
this morning. All Babies Are Equal is really captivating. So let me start with this. Can you briefly tell us about, what All Baby Are Equal is all about, and what inspired the launch in northern Nigeria?
Thank you very much for having me.
You're welcome.
Thank you.
And to start with, new incentives has been operating in Nigeria since 2017, just like you have mentioned. We provide small cash incentives for routine childhood vaccinations through our All Babies program. We partner with government clinics, just like you have mentioned, to ensure children get vaccinated from life-saving antigens. Now, the first questions might be, why cash, right? Well, cash is one of the major social determinants of health, and one of the barriers from people receiving immunization or from mothers taking their children for routine immunization has been the financial barriers. Why not come in to cover that cost, just so that they have these little stipends to be able to have them transport their babies from their homes to the facilities, or it can serve as a loss of income for the day, because there are mothers that are in the rural areas having local or petty tradings that they do daily. Sometimes they feel hesitant to take their baby for immunization when they know they are going to lose out on the interest for the day. So we came out with the idea of saying, okay, this should be done to cover this. And before the idea, a randomized control trial was conducted between 2017 and 2020 in the state of Zamfara, Katsina, and Jigawa. And what came out from that independent result, it shows that children in the places where the program operates the numbers show that the fully vaccinated children doubled in places where it's operating when compared to where it is not operating. So when you look at the control and the treatment clinics, you see that in the treatment clinics there's double vaccination, fully vaccinated infant when compared to the treatment clinics.
Okay, now you here I said the program is active in 11 states. You operate only in northern Nigeria. 11 states: Bauchi, Gombe, Jigawa, Kaduna, Zamfara, Kebbi, Katsina, Niger, Sokoto, Yobe. So why is it only in northern Nigeria? Do you have any? Are you people going to start in other parts of Nigeria or Nigeria as a whole, or you're just focused on northern Nigeria for now?
Well, it's not to say we're focused on northern Nigeria. The program started operating in 2017 with just 3 states. We're operating in the state of Zamfara, Katsina, and Jigawa, and in about 98 clinics or 98 health facilities. And now that program has grown.
It's expanded.
Yes, has expanded to going to 11 states as it is today, and we are working in over 7,000 clinics.
So what do the incentive mean to caregivers? How do they accept it? How is it going right now?
Well, so far so good. Let's speak about the impact of the incentives, right? From what I just mentioned, this RCT has shown that there's impact, right? Fully vaccinated infant in the places where it's operating doubled compared to where it is not. And we have between 2017 till date disbursed over 25 billion naira to mothers or caregivers who brings their children for routine immunization. And we have been able to participate in over 100,000 awarenesses. These are awareness and sensitizations. There is the community dialogue in support of the local government and the clinic staffs. So it is more than just cash. When we speak about incentives, maybe sometimes people talk about cash. It is more than just cash. We conduct sensitizations and awarenesses. We partner with traditional and religious leaders to ensure that people are sensitized and people understand the benefit of routine immunization. We also sporadically support vaccine push efforts in some of the states.
All right, the program is linked with immunization and health incentives. How do you ensure parents keep bringing their children for the full cycle of vaccinations?
Well, for every caregiver that comes to the facility, they get sensitized on the importance of vaccination as well as the benefit of facility utilization. This is done by the clinic staff. Now, I think if I can remember, there was one discussion with the executive secretary of Sokoto State Primary Health Care, and when she mentioned, she said new incentives, just bring the babies or just bring the mothers. Once they come to the clinic, there are professional clinic staffs that will sit down the way we are discussing here to discuss with these mothers to tell them the benefit of immunization as well as other add-on services that are getting conducted in the facilities.
So I would love to know what happens if a family misses a session. Do you follow up on that family?
Yes, there is what we call the falter tracking.
Okay.
We try to follow up in cases where people have not been able to return, to understand why they have not returned, what's the reasons, and have them. And in some of the facilities we operate, we also have people called community mobilizers. The VCMs has, I think, something they call the VCMs that they support. So basically, these are the same thing. We have community mobilizers, some of this whose job is to track some of these persons that have not returned for immunization.
Okay. Now, some caregivers are still hesitant about bringing their children for vaccination. We all know how northern Nigeria is, and you're dealing with the corners, deep inside the villages and communities. And most northerners there, the core northerners will tell you, I don't believe in Bature, the foreigners stuff and what have you. So now, what are the common concerns aside this one I told you? What are the common concerns they raise, and how do you respond to them? How do you try to convince them, no, this is a good one for you, aside the cash, How do you try to bring them from those villages to the hospitals?
Well, you see, what you mentioned are some of the misperceptions or conceptions that we have in the community, and that is where this sensitization comes in. Now, the LG and the state are doing tremendously well in addition to what we are doing, because the sensitizations and community dialogues that we hold are done together with both the traditional leaders, the religious leaders in some cases, and then the LG officials as well as the clinic staff.
Okay.
Now, we understand sometimes there might be people who are not returning. It's not just because they do not want to return, but because maybe there was vaccination and then the baby had took penta and then he was crying overnight, and the father will say, please don't take him again. I couldn't sleep yesterday and what have you. But for every visit, the clinic staff try to help educate the mothers that come to say, these are the antigens that are going to be vaccinated for a child today. And this might be some of the things that you might have mild fever, that is okay, and some other health education component. What happens is sometimes the mothers do not relate the same information to the fathers, and the father was not at the facility. So this is where now the sensitization, awareness, and community dialogues come in. We go to these places, sometimes even at the mosque, at the churches, and then we have this dialogue to discuss so that people can ask questions. Head of household or fathers or parents can ask questions, and they give responses from professionals that understand this in and out of it. And we tell them the benefit of immunization. It is more than just cash. It is the benefit you derive from getting your child vaccinated. And generally, people tend to understand. If you explain to them, they understand some of these things. I tell you, in some places, they become the ambassadors to enlighten others. I can give you an example. In 2017-18, there was in Zamfara State, I think in Bakura LG, there's a settlement called Badama. Under Badama, they have a catchment settlement called Zangom Bugaji. While we were on this routine default tracking effort, I met a person, and he has two wives, and then all of them were defaulting. I asked why didn't they return, and the first wife said, the senior wife said actually she went for ceremony and she couldn't come back, so she was waiting until the following follow-up date for her to come back. And then the other person, who was the junior wife, then returned also for the same reason. But then the person, the father or the husband, was actually more angry at the senior wife. I said, but this one she has gone over 2 months. This one has just done 1 month without baby. I said, no, forget about the junior wife. Ask her how many children she had previously. He said she had 5 children, and then one of them unfortunately died from measles. And all the others that have taken the vaccinations are doing well. He said you don't need to speak English to her. She knows that vaccination and immunization works.
Wow.
This is somebody that has not been educated. He's in a very deep rural community. So people tend to understand. They know the benefit, and the misperception or misconception is getting, I think it's going down. The religious and traditional leaders, as well as the state and LGs, are actually doing a lot of effort in terms of sensitizations and awareness.
All right, then let's look at the challenges, because of course you know, when you have such a huge initiative, you would encounter challenges here and there once in a while. So what are some of the biggest challenges you face in running All Babies Are Equal, and how do you handle resistance from parents who may not trust vaccines?
Well, I think the resistance is one of the things I just explained now. The challenges are there. Resistance is one of it. Now, no matter how we explain to some persons, they will still have that hesitancy. But with the continuous efforts of the traditional religious leaders, as well as the state and our program, we continuously sensitize these persons. And gradually, there are a lot of things that are happening that people are beginning to understand the importance of vaccinations and immunization. Now, another challenge, which are some of the things that come out more often from maybe the stakeholders, is around the sustainability, right? The question of sustainability. How will this program be sustained, or what will happen when this program is not there? Some also persons question about the intrinsic motivation or internal motivation of caregivers to continue vaccination even when the cash is not there. Contrary to the perception or some beliefs that financial incentives reduces internal or intrinsic motivation of caregivers, researchers have actually not found any evidence of negative impact. And we have had researches done in low-income, mid-income, and even high-income countries. What it has shown, rather, there is a positive effect in the long-standing, such that there has been research in the sub-Saharan Africa, and there's some research even in Nigeria that shows that fertility utilization continue to increase even when incentives or cash incentives are withdrawn. Perhaps people are becoming more acquainted with the services that are getting rendered at the facilities, or people are becoming more aware or having more confidence in the health system and the clinic staffs, or people generally now understand that these vaccinations work and my child is getting immunized and he's becoming, or they are becoming, healthy babies. So the perception or the dynamic shift is there. People are thinking differently towards a routine immunization.
Okay, now let's talking about challenges. Let's talk about insecurity. We all know how the North is affected with insecurity, especially Zamfara, Niger, Yobe, that this program is active in. So how do you go about it? How has insecurity affected this sensitization program, the incentive?
Well, for every place we operate, we have a dedicated security teams, and we are operating in places we deem secured enough, right? There are different avenues that can be used to reach caregivers, and those are getting explored. But we operate in all places that are security deemed secured enough for us to operate.
So it hasn't affected any of your programs so far?
Well, not entirely, but then there has been progress. Things have been moving in some places. There might be 1-2 places that we could not operate at because of the insecurity nature or insecure nature of the place. But things are opening up, and then we are expanding to some of those places. How we generally operate, or how it works, is for every local government we operate, we work at all the government-owned health facilities that are providing routine immunization.
Okay.
So we are not cherry picking, we are not picking some and leaving some out. We work across all. And in the 11 states, I think you mentioned the state of Kebbi, Sokoto, Zamfara, Katsina, Kano, Kaduna, Jigawa, Gombe, Bauchi, Yobe, Niger, recently. In some of the states, we are operating in all the LGs. The state of Kano, Jigawa, Gombe, Bauchi, we are operating at 100% of the LGs and 100% of the clinics. While in some other states, we are operating in relatively around 80 to 90% of the LGs, and we are not operating in some of the other LGs.
So what impact have you seen so far in terms of, child health and also survival rates generally?
Well, I think it's obvious. Things are improving. Things are becoming better. The impact of this program, like I mentioned, we have disbursed over 25 billion in Nigerian naira to these mothers. We have participated in over 100,000 awarenesses. We have also engaged in over 300,000 outreaches, which we conduct together with the clinic staffs and some of these settlements. So the acceptance is widely more open, and people are accepting immunizations and vaccination more often. People are beginning to understand some of these things even more.
Right, so looking ahead, do you see this program, expanding beyond northern Nigeria to other parts of the country?
Well, for now, we are focused on the place we are operating. I can't say no. We might be expanding because we have expanded from 3 states to 11 states, so we might continue to expand if the need is there. Before we expand into every state, there's what we call coverage survey, a rapid assessment that we conduct to understand if the program will be impactful and cost effective in those particular locations. Once the result shows that yes, there is need for that program in those places, then we go through raising funds to do that. Now, earlier I spoke about the sustainability component, and I have spoken about the behavioral change component, which people are beginning to understand more about the importance of vaccinations. Now, for the All Babies program, we raise funds in advance. So for every time we raise funds for 2 to 3 years in advance. So we have a 2 to 3 year funding run. Currently, we are funded until or through the March of 2028. And by the first quarter of next year, 2026, we will be raising additional funds for the places where we operate and the LGs as well as the clinics.
Okay, okay, go ahead.
Okay, that is just the first component. Now, like I've mentioned, it's more than cash. We conduct sensitization and awarenesses. People now understand the benefit of immunizations, and they understand to take their children for these routine vaccinations. We also leverage, or we are trying to leverage on the routine immunization cycles, where we provide these stipends to layer program additions, such that we are currently piloting a provision of ORS in Gombe State together with the routine immunization antigens. And we work with the religious and traditional institutions. Like we have an MOU with Sultan Foundation, which we try to sensitize the populace via the traditional and religious leaders. Now, for every visit, what we tell the caregivers is nothing lasts forever. Maybe in the distant future, these incentives might not be here, but the important thing is, with or without the incentives, continue to bring your children for these vaccinations. And they often respond, yeah, with or without the incentives, I now understand the benefit of immunizations, I will continue to come. We also, there's no current plan to phase out, that I need to stress, but just to, as a responsible stewardship, we engage with the state partners to come up with a phase-out program or a phase-out program phase-out, such that before any phase-out, there's at least 6 months notice provided to the stakeholders, and we have a 15-month winning period, right, for us to be able to deliver on all the promises of the cash incentives. So there is not going to be there's no current plan to phase out, and even if the phase out comes, it's going to be in this phase. We are not just going to pack things one day and say bye-bye, we are gone. That is not going to happen. This winning period will be there, and stakeholders will be fully informed and will be fully involved. Currently,
Amazing.
the state stakeholders all provided input, and we are continuously seeking for input on how to better this phase-out plan.
Amazing.
Okay, the program partners with government health clinics to ensure that more infants receive life-saving vaccines on schedule. Now, do you have any form of support from the federal government, let's say from Federal Ministry of Health, to like help with the incentive? Any kind of support at all?
Well, whoever is operating in the country has support of the Federal Ministry of Health, right? But direct incentives, no. But let's talk about the states where we are operating, right? The supports that come from the
state
states,
government.
the states. Yes, you see, this vaccines that are provided to health facilities, the training that is being provided to the healthcare workers, as well as this sensitization and awareness efforts are all done in conjunction and in collaboration with the state and local governments. I think you might be aware that at the local government, at the state level, they have a whole department that is for sensitization or advocacy.
Yeah.
Some places they call them social mobilizers, SMOs, while some call them health educators. Their sole responsibility is to ensure to continuously sensitize the populace regarding the importance of health services that are rendered at health facilities.
Okay. All right. For parents that are listening to you now this morning, what message do you have, to them concerning the importance of child immunization?
Well, now for the parents and every other person listening, vaccination is the most cost-effective health intervention there is. It is preventive, and with or without any support, each and every caregiver or parent should endeavor to take their children for routine immunization. Now they get immunized, they get sensitized, the knowledge stays, and the vaccination lasts. These cash incentives might not be here in the distant future, but with or without the cash, we should be able to take our children for routine immunization. It is important, and the importance cannot be overemphasized.
So now, a parent, like you said, is watching right now, but do not know how to contact the All Babies Are Equal, the incentive. How can they contact you? How do they get your contact, or how can they get to you?
Okay, we currently have a hotline number that everyone can call. The number is 070-4415-5555.
Please, can you take that again?
070-4415-5555.
Okay.
And we have our posters and all the program or all the government-owned facilities where we operate. And we have our staff, as well as even the clinic staff are available. All can be approached to ask questions regarding either new incentives or regarding routine immunizations.
So now, what's the next step for immunization in the states you operate in?
Next step? We continue from where we are currently. We'll continue to sensitize, we'll continue to support, and we'll continue to provide these cash incentives to caregivers who brings their children for routine immunization.
So anything you want to add,
Well, as a call out is people should be able to embrace this. People should be able to ask questions, please. If people are unaware of things, we should not have this misconception or misperception regarding things. We should be able to come out, speak with professionals who understand this, tell them. this is the cycle I'm coming for, or my child has not been vaccinated, you can approach the health facilities. The clinic staff are always there. You can even approach the local government officials. They are always there, and they are very willing and more than happy to support in providing clarity regarding anything that is ambiguous today. And we want to thank the religious and traditional leaders who have been actually very supportive in the cause of increasing routine immunization uptake in this country.
All right, thank you so much, Mubarak Bawa, Operations Coordinator for New Incentive, All Babies Are Equal. Such a pleasure to have you this morning on the studio, discuss this with us, and also creating more awareness as to why, people from the rural areas all over Nigeria need to understand that immunization, vaccination is very, very important. And kudos to you guys for such a brilliant and amazing initiatives.
Thank you. I will take the kudos, but I give that kudos to the field staff as well as the health facility workers who are our field officers and health facility workers who are working tirelessly day in, day out to ensure that each and every child gets vaccinated.
Amazing. Honestly, before you go, you need to call those numbers out again so that the viewers get to, jot it down or just, put it somewhere.
The numbers is 070-4415-5555.
One more time.
070-4415-5555.
Honestly, these All Babies Are Equal is a very great initiative, and personally, I'm thrilled. Must I say that something like this is really happening in the northern Nigeria? Thank you very much for this.
And the name again, All Babies Are Equal, is really captivating.
Of course, all babies
well
are
done.
equal.
Absolutely, they are well done to the team, and thank you once again for stopping by and educating us on what we need to know about this great initiative.